Hello everyone. In the spirit of World Prematurity Day, we are delighted to have Dr. Kishore Kumar, founder, chairman, and renowned neonatologist of Cloudnine Hospitals, a leading maternity and childcare hospital chain in India. Dr. Kishore's dedication to improving the lives of premature babies is inspirational, and we are so honored to have him with us today. A very warm welcome to you, Dr. Kishore.
Thank you.
As we mark World Prematurity Day, let's begin with a very fundamental question. What is prematurity and how was it defined in context to the newborns?
That's a very good question because most parents don't understand that there are different types of prematurity. The full-term pregnancy popularly is called as 9 months pregnant, but actually it is 10 months. In other words, by the time you know you're pregnant, it's already 1 month. And total pregnancy is considered to be 40 weeks. Any baby born between 37 and 40 weeks are called term babies. Beyond 40 weeks, up to 2 weeks, that is up to 42 weeks, they're called post-term babies. Babies born less than 37 weeks are called premature babies. But in premature babies, there are at least 4 different types. What we call as the late preterm babies is between 34 and 37 weeks. And generally, they are not much different compared to term babies. Babies born by late preterm babies are usually more prone to get jaundice, low sugar, feeding problems, and otherwise, generally they do extremely well. Babies born less than 34 weeks, but more than 32 weeks, are what we call as a proper preterm babies. Generally, those sort of babies need to stay in the nursery for about 2 to 4 weeks, and they can probably be cared for in most nursing homes or most hospitals without much ado. And most of those babies do extremely well. The problem comes with the babies who are less than 32 weeks. We call it as a moderately preterm babies who are above 28 weeks. Those sort of babies need a little bit more advanced care and they need a proper neonatal intensive care. And generally most of these babies, if they're cared well, they need to stay in the hospital anywhere between 1 to 2 months and they go home very well. There is another group of babies called extremely preterm babies who are less than 28 weeks, beyond 24 weeks. Unfortunately, in India, we started saving these babies only when we started Cloudnine. Before that, many hospitals were unwilling, parents were scared, and these sort of babies are not saved in most hospitals. And even if we look after them very well, generally they need to stay in the hospital for up to 3 months. So that sort of a preterm babies may have higher chance of problems if it is not looked after very well. So prematurity is complicated in that sense. Not all preterm babies are the same. And there are at least 4 categories. And most parents get frightened with the preterm word, but you need to understand that there are different types of preterm babies.
It's truly amazing to know that preterm babies can be saved to this day as well. Theme for World Prematurity Day this year is small actions, big impact, immediate skin to skin care for every baby everywhere. I've come across this term called as the Kangaroo mother care. So can you elaborate on what it means and its benefits for both premature babies and their mothers?
Kangaroo mother care is nothing but babies being carried by the mothers on their chest, similar to the kangaroos. That's why it's called Kangaroo mother care. And just like how the kangaroos carry the mother in their belly, the mother as soon as they deliver, even if it's preterm baby, they can carry, and the body heat of the mother keeps the babies warm. One of the problems with the premature babies is they get a low temperature or they get what we call as a hypothermia. To prevent that, we need to keep the baby in the incubator. But if the mothers can spend time and carry their babies on their chest, there has been shown to increase the bonding between the mother and the baby. And it has shown to improve the survival chances of the babies. It has shown to be improving the various other parameters of the baby, including stress levels of the baby, heart rate of the baby, respiration is regularized. So there are very many advantages. The Kangaroo mother care is popularly called as KMC, and that became popular in the last few years in the world, but we have been instituting that from inception in Cloudnine. In fact, we follow KFC also. in other words, what is called as a kangaroo father care. So we encourage fathers also to have the baby because its bonding is required both for mothers and the fathers, and that is certainly very, very beneficial and known to improve the outcomes in low and middle income countries by the randomized control trials which has been published lately. So it's very beneficial and increases the chance of survival also.
That's fantastic to hear. Now, I have heard about the intact survival. So could you tell us what it means and how Cloudnine specializes in ensuring intact survival for premature babies?
That's a very, very good question. Many people don't understand, many parents don't understand that premature babies belong to several categories, and babies who are moderately and extremely preterm babies are at high risk of developmental disabilities if they have intraventricular hemorrhage, that means the brain hemorrhage, or if they have a lack of oxygen, or if they have various other problems during the care. In fact, the intact survival word came in the last few decades mainly to focus on outcome of babies to have no disabilities at all. Lot of publications, if you look at, there is a report saying that premature babies have a higher chance of disabilities, but the premature care has improved in the last 2 decades significantly. Most of the reports, what you see in the textbooks or journals, is all 20, 30 years old. So those days, the outcomes were not that great. When we started Cloudnine from day one, our focus has been intact survival, which means that we want to send the babies with no chances of having disability. And we have specialized in that. In fact, most neonatal units have physiotherapists to cater for any problems or developmental disabilities like cerebral palsy, because the babies, once they start walking, will have problems. Just 2 days ago, we were saying bye-bye to our physiotherapist because we are not given enough work for him, because we don't have any babies with the disabilities. So he was being jobless, and he was saying that I have enough work in Cambodia, Vietnam, Malaysia, and various countries he goes to. So he was very happy, but he also couldn't believe that Cloudnine in the last 16 years, we have not had many disabled babies at all. So we specialize in intact survival, which means babies have a very, very good outcome.
That's very good to know. So in case of premature babies, NICU plays a very important role, right? So Cloudnine's NICU is known for its best infrastructure and technology. I've heard that it's certified as level 3 as well. So could you help me in understanding what level 3 means and what benefits it brings to the care of premature babies?
That's a fantastic question, because most parents don't understand. They think every NICU is the same. And the answer is no. The NICU levels, there are level 1, level 2, level 3. In level 3, again, we have level 3A and level 3B. What it means is level 3B can cater for everything, including cardiac surgery. In level 3A, we do everything except cardiac surgery. That means heart surgery. If the baby was born with any heart defect, then we don't operate in Cloudnine. That is the only thing which we don't do. Level 3 means the top level of care, which means we have the best team available for looking after the baby. We have the best technology. We have specialists. The specialists who are required in looking after the babies are cardiologists specialized in newborn babies, pediatricians specialized in newborn babies called neonatologists, and radiologists, pediatric surgeons who are specialized in babies, physiotherapists, nutritionists. So the whole team should be available, and any complication which the baby arises should be able to be handled in that center. So they need to have equipment to cater for that, both for ventilation. In ventilation, we have even advanced technologies called nitric oxide therapy, and we have also called therapeutic hypothermia, which are equipments not in every hospital, it will not be there. And so if you cater for all those equipments, all those needs of the babies, and you look after the babies for all other aspects, then it's called level 3. If you don't have any of them, then they can be level 2 or level 1 depending on what equipment they have.
It's great to know that Cloudnine provides such high quality care for premature babies. Speaking of which, what specialist expertise is available at Cloudnine for comprehensive care for premature babies? Also, if you can tell us about the members of the NICU team at Cloudnine, it would be lovely.
That's a very, very good question, because a lot of people look at one pediatrician and choose a hospital. And babies will be in the hospital, especially extremely preterm babies will be in the hospital for almost 3 months. So you really need a team of doctors, team of nurses, team of specialists, care providers to look after the baby, along with the proper infrastructure and proper technology. Without that, you can't cater for the baby. So we have neonatologists, that means pediatricians specialized in looking after the babies round the clock. We don't have duty doctors, we have duty pediatricians and duty neonatologists around the clock. And we have a team. That means at any given Cloudnine, we have 3 senior neonatologists and 3 junior neonatologists to provide the care around the clock. Then we have pediatric surgeons. Then we have neonatal nurses who specialize in looking after preterm babies round the clock. And most of the Cloudnines, we have about 20 to 25 years of service nurses who are specialized in babies. Then we have physiotherapists, then we have nutritionists, then we have pharmacists, pediatric surgeons who are capable of handling surgery if the baby requires surgery, pediatric cardiologists, then we have pediatric ophthalmologists, because premature babies need to be examined eyes for a complication called retinopathy of prematurity. Recently, you must have heard and read about a doctor in Chennai who was penalized by Supreme Court of India to the tune of 2 lakhs because he looked after the baby, but the baby developed blindness because they didn't look at the eyes of the babies. So those sort of things are avoidable. You need to check the baby regularly for the eyes. So we have ophthalmologists coming and visiting regularly, checking the babies. So it's a whole team of specialists looking after the babies, and that's why it's called NICU Team, not a single doctor.
So many viewers might now be wondering if prematurity can be prevented. Could you shed some light on how proper antenatal care can help prevent these premature births?
That's a very, very good question. And preterm care has improved in the last 4 decades, if you want to call it. And we have been looking after and saving the babies who are extremely preterm for the last 3 decades. But now the world is focusing on preventing the prematurity rather than treating the babies with the prematurity. The commonest cause of prematurity is high blood pressure in the mothers. So if you are pregnant, you need to check your blood pressure regularly and make sure that your blood pressure is under control. Second commonest cause is diabetes in the mothers during pregnancy, called gestational diabetes, and that should be prevented and treated accordingly. Third commonest cause is infection in the mother. We call it as a prolonged rupture of membranes or neonitis and all that. All that can be prevented with the proper antenatal care. The other thing which Cloudnine is specializing is we have done just a research. We have shown that if you give DHA, which is basically fish oil capsules, or there is a vegetarian source of fish oil called DHA from algae, if you give 1000 milligrams throughout the pregnancy, that can prevent prematurity. Now we have also started using artificial intelligence. People talk about artificial intelligence, but we have done a trial, and the human prediction can predict 22% of premature babies, but artificial intelligence, which is incorporated in our database, can predict up to 82% of the premature babies. So hopefully in the future, if you come to Cloudnine, we will be able to prevent prematurity to the 80% extent.
Wow, that's amazing. That's so good to hear. So lastly, I'm sure our viewers would love to hear some success stories from Cloudnine's neonatal intensive care units. Could you share a few heartwarming stories of premature babies who overcame the odds and thrived under your care?
That's a very, very good question. When we started Cloudnine 16 years ago, nobody knew Cloudnine. In fact, I remember the first few parents thought that Cloudnine is some sort of a mall or shopping experience for something, and they came to inquire and they started realizing that it's a maternity hospital. One such mother who came to inquire about her antenatal classes landed up delivering her baby in the lobby at 30 weeks prematurity, and the baby was weighing only 980 grams. And the problem was it was not only premature, the baby had a underdeveloped food pipe. That means the baby needed emergency surgery within 24 hours. And everybody thought being premature surgery, she may not survive. Now she's 16 years old along with Cloudnine, and she's a topper in her class in mathematics, and she also sings quite well. Then we have a lot of success stories like that which made Cloudnine a brand. In fact, I remember very well, one of the parents had come from the US for a holiday, the non-resident Indians we call it, or NRI couple, and they came here and they went into labor at 28 weeks. And the obstetricians were worried, thinking that this is 28-week NRI couple. If something happens, they will sue us. Should we deliver or not? And that boy is now a 16-year-old doing extremely well in the college. We have success stories only to tell. In fact, the latest success story, which I'm very proud of for telling, is 6 years ago, we had a mother who is an anesthetist, and her husband was a cardiologist. They were working in some other maternity unit, but they heard that our intact survival is so high. They came to our hospital to deliver, and they had a baby who was perfectly doing well. At 24 weeks, she was born, and now she is 6 years doing extremely well. So we have a lot of success stories like that.
Thank you so much for sharing such valuable information with us, Dr. Kishore. It truly is remarkable to learn about the specialized care and dedication that Cloudnine hospitals provide for these premature babies and their mothers. Also, we appreciate your time and insights today. Thank you so much.
Thank you very much. Good morning, everyone. And most people don't realize that prematurity, there are multiple varieties. There are at least 4 varieties. And extreme prematurity is what we call as less than 28 weeks and beyond for 24 weeks, in total pregnancy of 40 weeks. And Cloudnine specializes in intact survival of all these premature babies. The good thing is we also have emergency ambulance with all the technology that is required to fetch you from anywhere in Karnataka or anywhere in India, because we have 29 branches across India. And we have newborn emergency transport service called NETS. So if you are in labor, you have not to worry, you just need to call us. We'll take care of the rest of us.